adoption. We have Dr. Reuben Swamickan. He has worked on a lot of projects with the government of India and in collaboration with the government of USA. And Dr. Reuben, many of us are excited about the potential of digital therapeutics in the Indian healthcare landscape. And as we just heard from Abhishek, the journey has not been without its challenges. In your personal experience, could you walk us through some of the key obstacles you have encountered when implementing these solutions, and maybe share an example of how these were successfully navigated, these challenges?
Sure. Thanks, Kritika, and thank you everyone for being a part of this. And it's a pleasure to be here. I'll just quickly, talk about, Abhishek just mentioned scale, and I think scale is crucial because you're not going to see success without it. Also, coupled with outcomes is really what you're looking at. If you look at India's ABDM, right, the Ayushman Bharat Digital Mission, right, they've got over, I think 540 million uh, health records that have been linked, just 540 million individuals, almost 400,000 facilities, and over 600,000 healthcare providers who are part of the system. So that's scale at its best, right? Okay, where the challenge lies is, okay, what's the quality, right? How quickly do they respond, and what are we getting, in terms of outcomes or success for the patient? I think a lot of the challenges Abhishek mentioned mainly are regulatory, and I take his points really well, and I think Dil Raut also mentioned a number of issues that are there. But if you step back, from a regulatory framework, I think the biggest challenge within the regulation is the data privacy, right? And how both I think both the government as well as the individuals are concerned about how this data is being used, and I'm sure, and that's where the lag happens in regulation. But I think if that aside, the ecosystem needs to develop as rapidly. I think Professor Mingeti also mentioned the costs, for example, right, and how it's out of pocket, right? And so what does insurance do? Why is insurance not catching up? Right? What are the challenges that are there in insurance, to be able to pay for this rather than have the patient do it out of pocket? So I think insurance also needs to cover catch up to be ensuring that digital health services are part of their coverage plans, which generally are not, right? And so to ensure that there's a little more freedom in how they're able to use all of this. Also, I think the digital health tools, the cost of the digital health tools, right? Okay, so how can they be subsidized? Now, when you have such large numbers, as I mentioned earlier, the possibilities of subsidy are limitless. Something that really we should be looking towards, right? So, if you take the U.S. market, for example, it's all out of pocket, and that's where the costs are high, right? And I was recently, listening to, one of the organizations that are able to provide, say, a sphygmomanometer or, let's say a CGM or lancets and needles for free for diabetic patients, right? And so they're able to get the crowd in. He didn't mention the numbers, but I'm just trying to understand that all of that is for free, but how sustainable is it in the long term, and what are we getting in return? And I think the biggest concern there is again the data privacy in terms of what can be done. But I think in say in an Asian context, for example, right, and outside of India, for talking about infrastructure, I think the internet connectivity is pretty good. There are still pockets of India that connectivity can improve, but I think in terms of connectivity, we've got a lot of potential there, and so that's not so much of a challenge. Other countries do face that kind of a challenge as as we go into more underserved areas and more far flung, hard to reach, difficult terrain, and those kind of issues. But I think trying to improve that as part of the ecosystem will also be a great help. I think finally digital literacy in terms of how do we ensure that the elderly are able to best take it forward. And I think Abhishek mentioned it well in terms of voice, because voice is the game changer. And as long as you have voice in the local language, and I think translation now is not a big issue. Bhashini is software that's available in India that can convert into multiple languages, fractions of seconds. So I think language isn't a barrier. It's the ability to produce the material in local dialect that will really help people access these services. One, and I think digital literacy from a voice perspective is really what's going to take us forward. I'll stop there, but I'm happy to continue the conversation. Thanks.